Hello to our conference viewers. My name is Vinicius Benatti. First of all, it is an honor to be invited to participate in a very prestigious and a highly regarded event. This is an article made in 2019, and it is a case report about a patient diagnosed with normal pressure hydrocephalus. Here are the participants of the writing of the article, and a special thanks to Professor and Dr. Valeria, who made the writing of this article possible. So let's start with the clinical case. Here, a 72-year-old patient born and living in São Paulo, he started to experience gait apraxia, dementia, and urinary incontinence without time to progress until until seeking medical care of a 6 month denied comorbidities. Then a MRI scan was performed that showed bilateral ventricular dilation compatible with normal pressure hydrocephalus. So, based on the diagnostic hypothesis, a test was programmed and for greater patient safety, a CSF drainage device called a LiCoGuard was used after examinations, which was installed on the patient for 40, 48 hours with a total drainage of 120 millimeters. After the drainage of the cerebrospinal fluid, the patient improved his symptoms, and through the patient's positive response, a lumbar peritoneal shunt with a valve was indicated. The image rights of the patient and others were preserved. So the treatment is not pathognomonic in the diagnosis, of normal pressure hydrocephalus, as not all patients have all three specific symptoms. However, the patient in question presented all three symptoms. It has a higher prevalence, and its incidence is increasing worldwide. However, underdiagnosis is expected, mainly because the my finds are very non-specific, especially in the older population. For example, it is estimated that approximately 6% of the elderly over 70 years old meet criteria for PNH in the Norwegian population, and in Brazil, the prevalence is approximately 5% of the total of patients with dementia. So, the decrease in intracranial pressure result in stretching and a compression of the fibers on the cortical spinal tract in the corona hydrata, which are responsible for the innervation of the lower limbs due to the proximity to the lateral ventricles causing the gait disorder. In addition, impaired cerebral perfusion as well as prefrontal regions and brainstem compression, such as the pedunculopontine nucleus, also contribute to it. So, strengthening of strengthening the sacral fibers of the periventricular corticospinal tract. So this is culminating in laws of voluntary control of bladder contraction, and that culminates in urinary incontinence. the ventricular enlargement causing the cortex to displace the internal table of the cavity, and the hydro here forces cause dementia in the patient with normal pressure hydrocephalus. So, on the diagnostic hypothesis of normal pressure hydrocephalus has been raised, we must exclude differential diagnoses such as Alzheimer's disease and vascular dementia. All signs of the trait are not commonly found, making it necessary to exclude a differential diagnosis. Gait disorders are usually the first or most characteristic symptom of the syndrome. The gait of a patient with PNH is scramble magnetic and broad-based. With the progression of the disease, it becomes wide, slow, with short steps, and with difficulty in starting. Finding of gait of the abasia type. The gait of a patient with NPH has typical finds that consist on of a sternal rotation of the foot, difficult in rotating the body on its own axis, and difficult in starting to walk, with the possibility of its freezing. The diagnosis has both clinical and imaging criteria, from divisions between probable and possible and improbable of the diagnosis. But in Brazil, there is no agreement of the diagnostic criterion used and associated imaging tests. Sorry. The treatment um, is mostly surgical in many cases. So the lumboperitoneal derivation, the valve, is the first line of resolution of the condition to minimizing the complications of an intracranial procedures. So, however, there are other forms of treatment, such as other leads and ventriculostomy, as well as a non-surgical form, such as carbonic anhydrate inhibitors and serial lumbar punctures for non-surgical patients. So, to demonstrate some of the difficulties of walking, I brought a video that was made available by UCLA on YouTube. This is a patient with normal pressure hydrocephalus. The walk is the most characteristic of normal pressure hydrocephalus, and in this moment is possibly the freezing conform I related on the previous slide. So, the objective is to report a clinical case of a patient with idiopathic normal pressure hydrocephalus who had his symptoms drastically reduced after treatment. The work information was obtained by reviewing the literature, the patient's record associated with the patient interview, photographic record of the patient's examinations, and the examinations performed. So, a big one of the few untreatable causes of dementia, the diagnosis of normal pressure hydrocephalus is of great importance in the case, and the patient's quality of life. Among the adult hacking criteria, the three symptoms are found in the clinical case. It helps to formulate the diagnostic hypothesis. However, the trial is not pathognomonic. In addition to the signs and symptoms of the syndrome being non-specific and common to several comorbidities at older age, advanced, which leads to the need for complementary exam. So the association with the comorbidities is also of great importance at the time of diagnosis. A Brazilian study carried out with a survey of medical records at the Hospital das Clínicas of the Ribeirão Preto. Medical schools showed the 40% of the patients had a systemic arterial hypertension, and approximately 32% already had some previous involvement of the central nervous system. This, this shows that even with great suspicion of the diagnosis, it is necessary to exclude other causes of the neurological deficits due to cases such as stroke or more common causes of dementia, such as Alzheimer's disease and vascular dementia. So, the imaging exam of best choice to diagnose NPH is a magnetic resonance being the best method of visualizing altered structures. And to support the diagnosis, uh, CSF flow studies and magnetic resonance spectroscopy. Uh, the the magnetic resonance sounds consist of in many alterations. For example, the callus angle between 40 and 90 graus, dilation of the temporal horns are related to hippocampal atrophy, dilatation of the Sylvian fisheries, ventricular increase calculated by the Evans index, and suggestion an increase if it is greater than or equal to 0.3. So growth dilatation and disproportionately increased subarachnoid hydrocephalus. Um, so, and others alterations. Here, in the study of the flow in the CSF, a flow greater than approximately 25 millimeters per minute has a high specificity for NPH. However, the find of emptying of the aqueductal flow observed in T2 white high image is not useful. Nuclear medicine studies findings. Here is a four alterations. The first is a lateral ventricles, usually in the form of the arthritis, but they can appear in the form of a hurt. Uh, Tracer remains in the ventricular system for more than 24 to 48 hours due to the absorption deficiency, absence of tracer extension in the upper aspect of the lateral ventricles, and CSF reflux in the lateral ventricles. So here, the tap test or examination of the lumbar puncture has an effect equivalent to an acute treatment for the patient, often already showing signs and improvement of the condition. And in the same way, the patient has acute improvement of the condition due to the decrease in the amount circulating cerebrospinal fluid, which further corroborates the PNH picture both of motor functions, but mainly the of cognitive functions. Glycogard was used as a form of treatment in order to reduce the risk of hemorrhage due to sudden decompression or obstructions of the catheter due to the monitoring of CSF pressure in real time, being a new treatment method with less risk and complications, and with the associated advantage of improving the condition acutely, with some studies showing and is an advantage in studies of increased intracranial pressure. After the procedure, the process performed was the lumbar peritoneal shunt with a dose. So, the final consideration is differential diagnosis should be excluded after normal pressure hydrocephalus is suspect. Once differential diagnosis have been excluded, treatment should be performed as early as possible, as it is a treatable disease with a high rate of reversal of clinical symptoms exhibited by patients. It can be noted um, that the treatment proposed for the patient in question with the cohort was better than using TEP test, in addition to being safer and reducing the risk of complications um, after treatment. So the next slides are the reference used, and I thank you once again for the opportunity to participate in this conference. Thank you to everyone who watched the video, and until next time. Thank you.